other news, too, UN agencies have warned that the spread of the coronavirus has led to a dramatic fall in the numbers of children receiving life-saving vaccines around the world. The result means that many could die from illnesses that could have easily been treated. For more on this, I'm joined by our international affairs editor, Philip Turle. Hi, Philip. What kind of diseases are we talking about here?
Well, there's a figure you need to bear in mind here, Delano, and that's the figure 3, because it's part of what is called the DTP3. There are 3 big illnesses: diphtheria, tetanus, and the third one is pertussis, which is more commonly known as whooping cough. Now, they are 3 very easily eradicated illnesses that, if you are correctly vaccinated against, then you will not get them. The problem is that you need 3 vaccinations, 3 series of vaccinations to be inoculated against these DTP3 illnesses. And because of the advent of the coronavirus, many people around the world, especially in the developing world, are no longer going forward to get these vaccinations done. And the problem here is this is laying children open to a greater threat of contracting an illness when they're already under threat of contracting the coronavirus. And it also will threatens health authorities around the world will have to deal with greater amounts of illnesses as well as the coronavirus if these vaccinations are not undertaken as they should be. Now, the World Health Organization and UNICEF, which is the United Nations Children's Agency, have both blown the whistle on this, saying there has been, since the beginning of this year, a sharp fall in the number of vaccinations which are taking place around the world. And that's why they're warning that these vaccination campaigns must be kept up, because for the first time in decades, there has been a sharp fall in these DTP3 vaccines, which are through the most important in the world to protect children from falling ill later in life.
So is it too late, or could a massive vaccination campaign help remedy the situation?
Well, 85% of the DTP vaccines have been assured up until the beginning of the coronavirus. This has been stagnating really over the past decades. We've seen this sharp fall. Why are people not vaccinating? The main reason is that many mothers of young children are scared that if they go to a medical centre to ask for this vaccine, they're going to contract the coronavirus because they'll be next to people who have already got the virus and they don't want to bring it home with them afterwards. But that's not the only reason. There are other reasons which, for example, are a lack of transport, being able to take you to the area where you need to get the inoculation, because transport has been reduced to almost nothing as a result of the coronavirus. And also many medical workers are not available to be able to administer these vaccines because they've been drafted into dealing with Covid-19 patients. So that all of these elements brought together have penalised children to a great extent in African nations and also in Latin America as well. And that is why the WHO and also UNICEF are calling for an increased effort to keep these vaccinations up to date, because they say that we will get over the COVID-19 virus, but if we don't inoculate these children, then they're going to be at much greater risk. And I'll just give you a figure if you like. In 2019, 14 million children missed out on life-saving vaccines. That figure has risen very sharply in 2020, and that is why there's this alarm call now that people really should do those vaccines if they can do so. So if anybody is watching this and they have young children and they're scared about going to get these vaccinations done, then you really should get all 3 done, because your children will be at greater risk later in life if they don't get vaccinated.
Phil, thank you very much for that. Philip Turle there. And that's where we leave it. Thank you very much.